Hello guys. Hello guys. I'm getting my hair done. I took out my braids. That hurts. Wow. The hair grew. Dead ends. Cutting off the dead ends. The hair grew. Put some more. I took out my braids and I'm getting a new hair done. I'm using olive oil. The hair is so oily though. This is a quick hairdo. I'm getting my hair crocheted. Let me show you what I'm doing. I got this hair. Boho braids. New look. 2 packets. Hopefully it will be enough. I'm just gonna cornrow. I think I'm gonna do like 4. I'm not doing tiny cornrows. I'm getting some big cornrows. I think 4 will be fine. So while I'm getting my crochet hair done, I want to welcome everybody that is watching. If you are joining, for all those who are subscribed, I've already subscribed to my channel, I say thank you. If you are just coming in and you are not subscribed yet, please do me a favor and do so. Hello. So I'll be talking about sterile processing. I am into sterile processing, and it's a beautiful career field. And very little is known about sterile processing. Like, it's not really, people don't talk about it much, but it's been there because that is like the heartbeat of the hospital. Right? As a sterile processing technician, you don't only work in hospitals, any medical facility, anywhere that medical equipment can be reused, there is a need for sterile processing technician. Get that in mind. Any facility where medical equipment can be reused, there is a need for a sterile processing tech. Yeah. Pretty much as far as the training is concerned, for the training, we don't really have a standardized training. They are still trying to put that into practice, They are still trying to arrange that. So basically, you can get your training online. You can get training online. You can get it in person, depending. Online, in person, you can have your training. as a sterile processing tech. And it's very affordable. As a sterile processing tech, the training is not that expensive. Like at the end of the day, you don't have to incur any school loans, owing nobody. You go to school, you come out with something for a career that for this country, in this country, that is huge. That is a big deal, to go to school and come out without necessarily, you know, owing anybody like that for like as far as, yeah. I'm just doing some, not doing any serious braids. I don't know if anybody, most of the people like in my community as a whole, before I went into sterile processing, I didn't know anyone in my community who, who was in that field, you know. There was virtually nobody that I could relate that was into sterile processing. I just went there, discovered it, and then I pursued it. After the reading, I did a little bit of research. I was looking for videos. Unfortunately, I didn't really see many people talking about it, you know. That's one of the things that I'll be sharing to here. Like I'll try to throw light. If there is anyone out there that is, that is into sterile processing, or that is thinking about sterile processing, you can always drop a question, ask me anything that you think you want to know, and to the best of my knowledge, I'll try to answer that to you to the best of my ability, you know. And if I can't, hey, I can always refer you, or I can always refer you to somebody that can answer you, or that can give you the right answer. But pretty much, you know. So as a sterile processing technician, there are three main things. So you have decontamination. Decontamination is the first step. Like when instruments comes from the OR, from the operating room, they are sent down to us. Sometimes in a shift, there are people who go up there to the OR. They pick up the instruments. Sometimes they bring them down for us. They bring them to us. Sorry, my comb is falling. Sometimes they bring the instruments to us, and that's where the real process, the real work begins. You receive the instrument. At every point, there has to be documentation. You receive the instrument, you have to document that you've received this instrument, because some of those instruments, they are kind of like, time sensitive. You don't have to sit or keep them for a long time without washing them. There's it's all about the cleaning process, because the longer the instrument stays without being washed, the more difficult it builds bioburden. It will be hard to clean, So timing is of essence. When you receive the instrument, you gotta wash it. In the decontam area, normally we have like 3 sinks. The first sink, you soak your instruments. You soak the instruments, depending, some of them for 10, 15 minutes, 20 minutes. You soak them in cold water. Water should be cold, you know. You soak your instrument, and after that you transfer it to the next sink where you have your detergent. It's like hot water now. There the washing process begins. Some instruments are hand wash. You have to hand wash them. Basically, all of the instruments, before it goes to the washer, you manually, you have to look at the instruments. Some of them, you know, like if they are like scissors, or depending on the instrument that is bloody, like some of them have, some of them will even have like a skin, like flesh on them. You need to scrub them, wash them, brush them off, you know, manually brush them off before putting them in the washer. You rinse them, transfer it to the next sink, which is like you rinsing off the instrument. That's another hot water too, not so hot. You wash that, you rinse it, and then some, depending on the instrument, you can put them in the ultrasonic before you send them to the main instrument washers, you know, depending. The ultrasonic washes them like 15 minutes, 10, 15 minutes. You take it out, and then you put them now into the main cat washer that washes the instrument, you know. It's really cool. Then it comes out, the instrument comes out in the clean side. That's the decontamination process is over with. In the clean side now, the instruments are received, and the assembly, they call it the assembly side, where they assemble the instruments based on, you know, every instrument has its own trees, and so kind of like assemble the instruments. After assembling, you put them in their containers, and then you go now to sterilization. So for the sterile, we have the steam, the main types. We have the steam, and they'll have the V-Pro sterilization. For those instruments that are so delicate that they don't need a lot of heat, they go through the V-Pro machine. Like the scopes, some cords, batteries, you know, they go through the based on the sterilization process, and after that you take them to the storage. So those are like the the core of sterile processing. If you're working as a sterile processing in a day, as a sterile processing, like what we do in our facility, you're scheduled like in a week. You have a schedule. Maybe today you're working in decontam, the next day or two you do assembly. Like nobody just does you, so you have to be versed with everything, you know. Some is like loaners. You also have to work with loaners, like some of those instruments that the facility borrows or they loan from outside. So when they come in, they use them, and then you have to prepare them and send them back. So those are like the loaners, you know. What is this? Why is this one like this? Like this. Yeah. So pretty much that is sterile processing, you know. And it's really not that difficult, I would say, you know. It's really not that difficult. um for the entry level, the pay, you'll see, because most of the time it's like high school diploma to get in, you know. So off the bat, you have no certification yet, so the pay sometimes might not be all that great, but you just have to hang in there and get those certifications, get the experience that you need, because you need a lot of experience to be able to, you know, move up, you know, especially when it comes to instrumentation. You got to know the various instruments, and it's a lot. That's one of, like, I would say, the challenge, the challenge that most people face is when it comes to assembly, because we have a whole lot of instrument from, you know, just imagine all the various parts of your body that surgery is being done, you know. Let's go with the system, the respiratory system, cardiovascular system, you know, all the systems of the body, you know, just to name all of them. And just to think about all the surgeries that are being done, eye, head, neck, toe, you know, C-section, the babies, for those having the babies, labor and delivery, all, you know, like, so just imagine. So that is it, to be able to know all those various surgeries and the instruments, the various instruments that are being used, you know, to be able to assemble them properly. Not only to assemble them, but make sure that everything is done right, you know. Everything is done right. There is no, they don't want a situation where a surgeon, they'll open somebody up in the theater and they'll open a tray and they'll not be able to find what they need because you didn't put it in there, or you forgot to put it in there, you know. That's a big deal, because just a minute delay or 5-minute delay can be disastrous for a patient. So sometimes people feel like it's a simple job, but it's a very delicate job, because one error, can you imagine, you know, like, you have to be very careful, bowel burden, you know, like when the person washing the instrument, you have to take your time to wash the instrument, because just imagine that it was your loved one that those instruments will be used on them. You don't want them to end up with an infection. You don't want that. So you have to make sure that you are intentional, you know, do your best. And even on the clean side, you still need to double check, you know. If you see an instrument that is not clean, it's your responsibility to send it back to be rewashed. It's your responsibility to send it back. You got to send it back to be rewashed, because you don't want somebody to come out with an infection, or to end up with bowel burden, because they track those stuff to as a sterile processing tech, you know. You don't want to be working and in a month you are having several bowel burdens on the trays that you work on. That's not good. You can be fired, because patient safety, you are jeopardizing patient safety right there. That's not good, you know. So everything is very delicate. Everything is delicate. Some people feel it's easy, but you gotta be careful. gotta be careful. Like today, for example, I was working with robotic arms. Like I was working with robotic instruments like the Da Vinci. I think I will share a little bit about the. I will share maybe later. I'll put a video up. Just give you a snippet. You know, those you need to check. Like there are things that you need to double check to make sure that insulation is top, is perfect on every arm that you put in there. Because if you mistakenly, if you miss a process, you don't follow the process, or maybe you feel like, oh, how you have several, you just check and then you bypass, be like, oh, let me just see. Look, you don't follow the process and do the needful, what you are really supposed to do, or you don't listen right and you have a beep and you undermine the beep, and then what happens? You end up using processing that instrument, and when that instrument is used on a patient, it burns the patient up because it's arms, it's robotic, and they put it in the place. Just imagine you, like your loved one is the patient right there on the hospital bed, and they're like going in with the arm in there with the electricity and everything, and because you failed to do your job, to check properly, guess what? They are all burnt. That's not nice, so every little thing that you do, you just put yourself like, one day I might be the patient. The Bible, as the Bible will say, do unto others what you want them to do unto you. You want good things to be used on you. Yeah. You want perfect stuff to be. Let me put my glasses on. I don't know. Hi, Naomi. Hi, how are you? So I'm talking about sterile processing. The sterile processing experience, Why getting my hair done? I work nights, so I need to get this quick and be out of here. It's a quick weave. So if you have any concerns, I know some people, like, some people, like, you finish school to have like the hours, to have your hours, because after you finish, you need, like, most of the places that they offer training, they don't offer you the hands-on experience, which is like, this is a field where you can't do without hands-on experience. You need experience, and most of those training, like, when they do, some of them will promise you that they do offer, but at the end of the day you find out that they don't. That's just it. They will tell you that they will help you, like where I had my training, they'll be like, oh, they'll help you look for a place, but at the end of the day you are on your own. You gotta push to get what you want. That's just it. Can't sit there and be saying, if you sit and wait for them, you're just wasting your time. You have to be proactive. Go out there and make it happen for you. They don't care. You already pay them their money. They don't care. So that's one thing that normally turns people off the training sometimes, to have the 400 hours. But there are some hospitals that, like my hospital, will take people and they'll train you, When I was hired, most of the people, they didn't have no prior knowledge of SPD. They were just off the streets or coming from another career. Like me, I was coming from another career and I got there. So it is really good if you want to be in healthcare, but you don't want to work directly with patients. It's a great place to be. It's a great field to be. You know, there's growth. You can grow. You have like level 1 tech, level 2 tech, level 3 tech. So there is growth depending on the levels, and that also will determine your pay too. You know, there is growth in it, and the growth comes with certification and experience. So growth is earned. You have to earn it. You have to earn it. It takes time. You cannot grow overnight. It takes time. Don't think that you come there, because everything takes time to learn the process, to learn instrumentation. You know, everything takes time. But it's doable. It's something that is doable. You cannot only be, you can be an educator, you can end up being an educator, you can have supervisory roles, you can have managerial roles, you can teach. People go into teaching, they can teach, you know, if you're good. No. Gosh, this one. I didn't want to sew my hair with any thread. I just wanted to crochet it down without sewing it. I hope it flattens it enough. It's curly hair though. Sometimes you can get away with it. How do I see? Like, this hair looks a little bit rough. I don't know how this will look, guys. About just 2 pockets, and I feel like I'm not even 2 braids down yet. Hopefully it turns out good. So anybody, I don't know if anybody has heard anybody, or you know anybody doing sterile processing, and how is your experience so far? Do you like it where you are? You know, there is, and pretty much, you know, like some other people, where people will be all over your business. Like in my case, like, if you know what you're doing, you just go in there and mind your business. That's it. You go, your schedule is right there. You know exactly where you are. You go mind your business. At the end of the day, you go home. Yeah. You don't really have to talk to anybody if you don't really want to talk to anybody. Except when it concerns, you know, like work-related conversations, or if you want to find out about something. Yeah. Pretty much that's it. But if you don't really want to talk to somebody, you can be in it and you don't talk to anybody. That's it. This hair is so light. Oh my god, it's so light. Hopefully it turns out good. I'm in my basement. My basement. My home salon. This is a dedicated spot in my home if I want to get hair done, to avoid hair all over the place. I didn't want to make my braids too tight because I'm not gonna keep this hair for a long time. My scalp now is very sensitive. Okay. Okay, how is it coming along, guys? How is it coming along? I think I can do 2. I don't know. How is it if I do 2 in a minute? In another. This bubble, this is freezy somehow. Looks like it's freezy. Need to mousse it. Anybody, I don't know if anybody, if you come across this video that you're into sterile processing, let me know your experience and where are you. I'm in the DMV area. Where are you? Where are you? You know, how is it? How is the feel in your location where you are? You know, do you like it? How long have you been there in it? Do you enjoy what you do? Because I, for one, I enjoy what I do compared to what I used to do. I love it. I love, like, you know what it means when you leave your home, you're going to work and you're not feeling burdened. You are not feeling frustrated. You are not feeling overwhelmed. You know, that is the most important thing. You know, you are not like under any kind of pressure. You know, like, you're not worried how you'll be like trying to watch your words or how to talk to people or stuff. No, no. Once in a while, we might have a situation where maybe like the workload, or we have like so many, because I work in a big facility. In a day you can have like hundreds of cases, you know. So depending on all kinds of cases from C-section, L&D, from cardiovascular, CVOR, from the robotic instrument, from the eye, from, you know, like whatever, craniotomy, all kinds of surgery you can think about, you know. I don't know, food, dental, all kinds. But there are still, you know, like just like any other thing, there are always some areas, or there are always some kind of surgery instrument based on the kind of surgeries that I'm still not comfortable doing, you know. Like some of the CVOR instruments, I'm still not really comfortable. And most of them, you know, like is emergency. You see, somebody's having a heart attack, boom. Combined spine. Combined spine, not all that bad though. Oh, it's coming alive. You see that? You see that? You see that? You see that? I'm already feeling pretty. I'm already feeling fabs. Already feeling pretty. Already feeling pretty. The only thing I didn't like, I think I did this cone was too big. They want to sit here. Oh, they didn't cornrows. They didn't want to sit here doing cornrows. How are we all doing? How are we all doing? And we have the HSPA seminar coming up. And this time it's in Baltimore. It's very close. Baltimore. Of course I'll be going. I don't know if anybody, any sterile processing tech in the house. Are you going for seminar? Will you be attending seminar? Last year it was so good. It was in Louisville, Kentucky. I'm so looking forward to it. A lot of network. So looking forward to network. I always tell people, like, when you are in a field, right, you need to be able to, and they have like an event where people from the field come together and they discuss, you know, innovations in the field, you know, changes in the field. It's always good to be there if you can. Always good to be there, because you meet people that on the normal you never meet them, you know. Just imagine you a tech sitting in the same room with directors of hospitals like John Hopkins. Yep, it's possible, you know. It's always good to network. That leads, it leads to growth, you know, a lot of growth, a lot of experience, you know. Somebody can share you something that in your lifetime maybe you never, never, never have known. And then you also see opportunities, you know, gives you room for opportunities to know about opportunities in the field. What am I talking about? Yeah. So if you are an SPD tech and you're in the DMV area and you're not going to seminar in April, you really, please make it a point to go. It's right here. You don't need it's just a driving. You don't need to pay no hotel. Depending where you're in, as long as you're in a DMV, you can drive. You can still choose to drive, to just make that drive there, you know, and come home. You save yourself all hotel bills and all the like you can still make it. But so far my experience has been good. I love it. I love my job. I love the people. I love my little tribe, you know. It's cordial. Everybody wants you to grow. Everybody wants you to win. They're ready to support you, help you, guide you, which is important, you know. People try to be helpful as much as they can. So if any sterile processing tech, you know, if you have any questions or you want to, or you're thinking about the field and you want some clarity, you know, drop me a message. You can drop a message and I'll do my best to answer you, to clarify any doubts you have. You know, we grow together, we learn together, we build together. Oops. Oh, it's giving. You see my hair? You see my hair? You see my hair? You see my hair? Yeah, this hair, I didn't think it was enough. I think it's gonna make it. There's this song that has been living in my head rent free. Holy Ghost Party. Even did a song. Did you get your praise on today? It's a Holy Ghost party. How is my hair, guys? I think mission accomplished. Mission accomplished. Quick, easy. Quick, easy, quick, easy, quick and easy. Okay. I have this. Oh, it's so light. The hair is so light, guys. It's so light. Oh my god, it's so light. This is so pretty. It's so light, guys. This is beautiful. It's the Holy Ghost body. And even like SPDs, you know, like these places where they manufacture meds, medication, and everything. SPD can work there. It must not. You can work in hospitals. You can work outpatient. You know, dental offices, doctors' offices. You know, anywhere, any medical equipment that is you that can be reused, because all of them, they have, you know, you reuse the instrument, you use it from one patient to another. You gotta have a process to be able to clean those instruments in a way that there is no infection. That's one thing. 'Cause SPD, like you see, is kind of like the French would say un peu de tout. Un peu de tout, you know. You have infection control. You have to be big with infection control. Because if you're not, you're just gonna have everybody sick. Infection control is a big deal. Because if not, just gonna make everybody sick. And we don't want that. You do the back of your head just by feel. Just by feel. Just by feel. Kind of like going in, touching the spot that I feel like it might be visible, and closing it. It's a Holy Ghost body. Just keep it clean. I'm trying to press down because I have like a knot where I ended the braids in the back. So I'm trying to close it in a way that it lays down flat. Like, I move the hair, I don't need to be seen. Not to come loose like that. I don't want to push in the front. I think that is enough. This one should just go in the back to cover this. Getting some crochet boho. Easy going. I've had braids for like, I braided my hair for my birthday. It was a day on the 21st. I just took the braids out. And I'm getting crochet installed. I'll wash the hair. I don't wash my hair like that. My hair is natural, so try to keep the moisture on. But after I take out this, I have to wash it. It's a Holy Ghost party. How do you think, guys? What do you think? What do you think? I think it's all right. I'm just trying to put this in. Last one. No, don't care. I'll put this my way. It's all done. See what I like about crochet hair? Okay, we're gonna mousse it. Mousse. Just gonna air out. Just gonna air out. The mousse is gonna air out. Take away the freeziness. Like it's not. It's really pretty. Mousse it down. Mousse it. Oh, looks pretty. Let's go in with some shit. New hairdo, new hairdo, new hairdo. Hello, hello, hello. Look at the back. You see the back. You see the back. You see the back. You see the back. Yeah. And that's my new hairdo. That's my new hairdo. New look. Ooh, I missed one. I'm gonna put this one in. I missed one. I missed one, guys. I missed one. I'm not leaving no hair out. I still got one hair. It's gonna go in. I'm not leaving it out. Let me see. Like, yeah. Don't feel. That's the reason I had to cut my hair, because see how quick this was? And you got your hair done. You don't have to sit. You don't have to sit for hours to get your hair done. I took it out today, the 2 hours. We're talking and I get it all done. Thank you so much for staying with me, doing my hair and talking about sterile processing. If you have any questions, let me know. Thank you. Mwah. Let me see my glasses. I can't.